This, let's talk about this. Now, you go to the hospital because you're having pain, like severe abdominal pain, cramps, you're feeling fatigue, and the next thing your doctor is saying, you're in labor. You feel shocked, like, how is this possible? When was I pregnant? So now today, guys, I want to talk about cryptic pregnancy, and this is your pharmacist Evelyn Awele. Now, there are a lot of videos going around on TikTok as regards cryptic pregnancy, and it is very, very possible. So what is cryptic pregnancy? Now, cryptic pregnancy or stealth pregnancy is a rare condition where a woman is pregnant and she's not even aware that she's pregnant till the last few weeks of pregnancy or when she's about to give birth. Wow. It's also called pregnancy denial. Now, what are the symptoms? Are they symptoms just like pregnancy symptoms? Well, it could be present without knowing, or it's even absent. When we know the normal symptoms of pregnancy, which is swollen breast and all of that, symptoms are usually absent, making it difficult to know if you're pregnant or not. One might show weight gain later on, fetal movement. You just feel that there's something moving around your stomach, fatigue, or abdominal pain, but you're no baby bump, nothing, and you're surprised what's happening. So that leads us to the next question. Now, can a pregnancy test confirm pregnancy? Even ultrasounds can appear negative. Yes, you might not even see the embryo or the baby. Now, there are reasons for that. If the shape or the position of the uterus can actually hide the embryo, it makes it difficult for scan to even see that there's a baby there. Now, the next question is, can a woman see her monthly flow? The answer is yes or no. Okay, let's see. Some women will actually see little blood, what is called spotting, and you might think that, oh, you are menstruating and so on. So that brings me to the possible cause of this cryptic pregnancy. Number one is PCOS, called polycystic ovarian syndrome. Now, this is a condition where a woman does not see her period regularly, like irregular monthly flow, right? You don't see your period all the time. It takes some people 2 months, a month before they see their period. That could be a cause of cryptic pregnancy. Then next is perimenopause. Now, this is the pre-menopausal stage. Menopause is when you don't see your period anymore, and that period when your body is preparing not to ovulate. Now, at that period you might be pregnant, you don't even know. Then the next is physical activities. Now, if you are involved in rigorous physical activity, or you have a low body fat, this could actually cause cryptic pregnancy, because you're not even aware you're pregnant. You might even get pregnant at this period. You don't know your body anymore. There are changes in your body. This could cause cryptic pregnancy. The next is birth control pills or IUDs. You guys, they might fail. They might fail you at a point you don't even know. Your mind is that, oh, you have this confidence that, yeah, I'm taking pills, I'm on IUD, so I don't think I can get pregnant. But boom, it happens and you're not sure. Then another cause could be that you're just a new mom, right? And you're thinking that, fine, your hormones are working fantastic, like you cannot get pregnant anymore. You can't get pregnant at that moment, but things can happen. Things can happen, you're not even sure. So those are the possible cause of cryptic pregnancy. Okay, so there are 3 classifications of cryptic pregnancy. We have the affective. She acknowledges the pregnancy. That's the lady acknowledges the pregnancy, but she's not prepared, emotionally, physically, for any childbirth and parenting. Something that comes to you as surprise. You have to be prepared, right? But here she's not prepared at all. That is the affective kind of cryptic pregnancy. Now, the next is psychotic. Now, the lady might have mental illness, e.g. bipolar disorder. Next is pervasive. They lack emotional significance to pregnancy. Now when they become aware later, they avoid anything that has to do with medical help. They avoid medical help. So with all this said about cryptic pregnancy, it have its side effects, big time. Yeah, it has its side effects. Now, it can be dangerous because it leads to some health risks to both the mother and also to the baby. You can imagine taking care of yourself. One, you don't take care of yourself, as I said, and you miss out on any prenatal care and also vitamins that you need to take for your health and also for your baby. Secondly, you don't get regular tests and checkup. Yeah, the baby could be at risk for any complication like anemia, gestational diabetes, and even birth defects too. And to those that have careless habits like smoking, taking alcohol, it's very, very bad. It's very risky to yourself, especially to your baby. Now, there are some drugs you don't take while pregnant, but because you don't know you're pregnant, you might take these drugs and it becomes harmful to your baby. So now, if you notice there's any irregularities or there's strange symptoms with your monthly flow, or as a woman, you're supposed to know about your body very, very well. Like when there's a problem, when you notice that there's something wrong with your body, you need to speak to your doctor, or you speak to the gynecologist, right? Talk to them about those feelings, those strange changes you're having in your body, so that you won't be caught up with cryptic pregnancy. Okay, now thank you guys. Bye.